Good morning. We're going to let everybody get a chance to join, so we will start in just a few minutes. Thank you all for your time.
Hi, Shelby. This is Denise. Can you hear me?
I can. It does sound like we're slowing down getting new people joining. There are still some joining, so we can wait a couple more minutes probably.
Okay, I'll just mute my phone and you can just let me know when to get started.
Okay, perfect. All right, I don't think we're getting anybody new now. So Denise, if you want to go ahead and start us off.
Okay, this is Denise with DMH. I kind of wanted to start this morning with a few questions we've had that we've tried to answer that may benefit the rest of the group. One of them, I think there was a SOAR call yesterday, and that kind of pertains to your SOAR clients that have been entered since April 20th or anytime this month, being asked to enter your SOAR clients into WITS and complete the GIPRA so that the GIPRA will be sent to SPARS, which is the federal system. This is an automated process in WITS, and what this can do for you is eliminate the future spreadsheet process for new clients. Currently, probably since last July, you were asked to submit a spreadsheet via Hightail to Gary Touchstone, and he was manually taking that information and entering that information into the SPARS system. And since we have WITS, and WITS has the connection between WITS and SPARS, this information automatically gets transferred. I think that will be a little easier process for you guys. You will also have reports available in WITS that you can run on that information. So I talked to someone that's Region 6 this morning and kind of went through that process. Are there any questions about the SOAR entry into WITS.
Hey, Denise, this is Mike down at Region 12 or Pine Belt. Is there any informational documents that have been sent out on that for us? I know you mentioned a while back. Just want to make sure that we've got that so that we can get that out to you.
Mike, are you referring to the document of how to enter a SOAR client and do the GIPRA?
Yeah. I don't know if my team may have already gotten it. I know there was some mention about the GIPRA stuff. I just don't remember if we got the instructions on that.
Well, a lot of this information is on our website under providers and WITS documentation. There's also a training tutorial when we went through the training for the SOAR GIPRA entry.
Okay.
That's available too on the website.
Okay.
If you want to download that and make it available for the users. If we need an additional training, that can be provided too. Just waiting on to see if that's something that's needed.
Okay. And have y'all received anything on that from Clearview or Isaac, any of the people up there?
I have not heard from them.
Okay. All right. We'll touch base with them as well. All right. Thank you.
Okay. And you may wonder how this relates to the data warehouse. So questions have been, if we enter the SOAR clients into WITS, do we also submit them to the data warehouse? And the answer to that is yes. We're going to work to not duplicate client data. And Shelby, you may could help me here with this answer, but I'm assuming all services and all clients need to come into the data warehouse through the data warehouse submission portal.
Yes, so SOAR clients won't be sent from WITS to the data warehouse. That SOAR information is my understanding. So if they are being seen and given other services that you're entering into your own EHRs, those need to come with the data warehouse submission.
Okay, so if they submit SOAR clients through the data warehouse, we won't be duplicating records to TEDS.
Correct.
Okay, the only other thing I kind of wanted to let you guys know, part of the reason for implementing WITS and the data warehouse, not only to replace the CDR, which many of you have had problems with the CDR and accurate reporting and receiving errors you couldn't fix, and WITS should help improve that. But it's also the long-term goal is to eliminate the manual reporting that you're having to do today to Department of Mental Health. I know there's several for grants, individual spreadsheets you guys are asked to fill out. There's probably other things that you're being asked to submit to DMH. We're hoping to have that data in the warehouse so that we can generate the report from the warehouse. And you guys will have access to generate these reports as you have access to generate reports in WITS. I think we've talked about internally of setting up, it's not a training, but just kind of overview of the reports that are available in WITS so that you can see your data, you can export your data. We didn't include that with the initial client entry training, but we feel like that would be a benefit for you guys. Can I get any feedback on that, if that would be beneficial to set up a call to show you the reports that are available in WITS so that you can see your data?
I think that would be good. I also think it would be great that we can pull our data out, so if we have a problem, we can figure out what's going on.
Okay. Is that Bree?
It is.
Bree, I have you on my list. I'm going to call you, I promise.
Okay, well, my question was really just about I have no idea what the bed census is.
Okay.
So it doesn't really have anything to do with this. It's just the bed census. I've never heard of it and don't know what it is. I'm not sure if we're doing it or not, or. So,
Okay. I'll call you. I wrote your number down.
Okay.
I just keep flipping the page. I'll put you on this page. But as far as the manual reporting, because I know Region 8 has contacted us too on the magnitude of the manual reporting that DMH is requiring. All of that has to do with the grant reporting. And so we're trying to put together reporting mechanisms that can be run out of the data warehouse. They're called SSRS reports. And for those of you that have technical resources,
SQL
it's
Server
possible
reporting.
that you guys can do your own SSRS reporting in the event you need additional information that's not provided by a report that we're doing. Okay, Shelby, I think that was all I had.
All right. Thanks, Denise. So before James starts, I have a couple things. So providers that have logins to the data warehouse, you can now start testing uploads when you have your files ready from your vendors. So you should be able to log in and start testing. And then I also wanted to give an update. Our next call is not going to be until June 10th. We had to cancel the June 3rd call. So we rescheduled that one for the 10th. So you have 2 weeks without us, but feel free to keep sending your questions to that EHR help desk email address in the meantime, and we will get those answered as they come. So that is all I have. James has just a few things to cover really shortly, and then we can do another open Q&A if you all have questions.
Shelby, can I ask you a quick question?
Yes, ma'am.
I know you're wanting the providers to upload the data or to the submission portal. Is it going to be a problem if we do that for them at first?
No, you mean for DMH?
Well, for DMH resources to receive the file and do the upload for them.
Yeah, that'll be fine. We just have to make sure that you're set up, whoever at DMH is going to be uploading the file is set up with the proper submitting entity, which is really easy to do. So then it connects. But yeah, that won't be a problem if that's how you want to test.
Okay, Bobby, do you or Kim have any questions around that?
I'll take that.
Oh, I guess I'm sorry, they can't talk.
Hello, can you hear me?
Yeah, I can hear you.
Okay, great. Sorry, this is Bobby, and I am probably going to be the one who's going to upload the provider documents for DMH, at least at the start. And I believe I know how to put myself in the correct entity group, but if I need help, I will definitely reach out to you guys.
Yeah, it's like a, Kim, what if one file contains agencies? It should not. One file can contain multiple provider sites, but it shouldn't have multiple agencies.
Got it. All right, thanks.
Okay. I think, Shelby, this is referring to, we have one system for our DMH state hospitals, and that one system is going to generate the files for 6 agencies. Are we saying that it has to be split out and there has to be 6 separate submissions, splitting out the agencies, clients, treatment episode, and services?
It should, because they all need their own provider source record identifier, and there can only be one of those on each file. And so if there's only one in there, it would only get associated with one provider.
Another point is, as you're uploading, you have to select the submitting entity with which you want to upload the file. So you choose the submitting entity and say this is going to be the submitting entity for this file, and then you upload the file. So you can't do multiple submitting entities at once, so you would need to have one file per submitting entity, if that makes sense.
Okay, Kim, you can put in the chat. Did that make sense?
Great.
Okay.
Thanks, Bobby. I mean, sorry, James.
Okay, was that it, or are we ready to move on to the next?
That's all I have.
Okay. As Shelby said, there were just a couple of topics I wanted to cover. The first was some questions that had come up about the GAF score known screen, excuse me, field. Shelby, can you see my screen?
I can.
Okay, great. So this is the treatment episode submission guide, which as was discussed on the previous call, the latest and greatest version of this is available on the DMH website. Shelby, I believe you sent that out to everyone. So you should have the latest copy of all of the documentation. And before I actually talk about these two specific fields, I wanted to talk briefly about what I call known code field pairs, which is, this is something we do with integer fields, where if you have a selection field where you can select, you know, let's say the values might be in state, out of state, or unknown. That's fine, and you can do that. But if you have an integer field where the value would be a number, there's no way to say unknown. So the field can either be an integer or nothing. And to sort of make it so that when you don't supply a value, you're explicitly saying that the field is unknown as opposed to it just wasn't sent. What we do is we have these known code fields. So with fields, with integer fields, we'll frequently have a paired known code field. And the known code field just says, hey, do we know this number? Yes or no. And the rules about whether the field is required are on the known code. So you'll see the known code. In some cases, it'll say, you know, this is required if it's a mental health admission, or this is required if the client lives in state, or whatever it is. And in this case, the Global Assessment of Functioning known score known code is required if this is a mental health admission. So if this is a mental health admission, this field is required. My understanding from the discussions that had been happening is that this is not used. So the simplest thing to do here is just say no. So for this field, you would put that it is not known. That makes the second part of the field not required, and that's all you'll have to do with that. Yeah, so I see the comment coming in that PB doesn't use the GAF score. Yes, GAF is obsolete. It was put into the, yes, you can hard code the GAF to unknown, yes.
But James, when I
Yes.
looked at the SAMHSA documentation, it says it's optional for mental health. So we're making it required in the data warehouse?
Where does it say it's optional?
I'll send you the page number. It's in the SAMHSA TEDS manual.
So this was probably something that was just missed during our requirements gathering, that we didn't notice that you guys don't do this assessment anymore. But so the answer there would just be that everyone says, no, it's not known. And then we don't have to collect the score.
Okay.
That's the easiest way to move forward with this one. It was included in that TEDS manual as optional, but it was there, and so I think that's how it got brought into here.
How does this affect data to DMH feds grants? I'm not sure what the mapping is for this to TEDS, or if it is being sent to TEDS. I can research that one.
Yeah, I think the known code is being sent to TEDS, and so everybody's answer will just be no, that we don't know the score.
I will check on that. Absolutely. The next topic I wanted to check in on was that the XML schemas have been updated and posted on the Mississippi website. So please download the latest and greatest XSD files. And the change I am aware of in those is the citizenship field being added to the client schema. Another point I wanted to make, because I have had a few questions on this, was how to figure out whether or not something is required, and if it is, when it's required, or if it's required all the time. So whatever field you're looking at, wherever it is, you'd first need to figure out which data set it's in, whether it's a treatment episode or a client or service event. Once you've done that, you would open up the relevant submission guide and just find the field. And let's say we'll look for injection drug user code, and injection drug user code is required. That means it's always, it is always required. And if you wanted to see a more sort of contextual vision of where that is, if we look here on the diagrams, which you have this in PDF form, that is at the root of provider treatment episode. So you can say, and I can zoom in a little bit so you can actually read that, but we know that every time a provider treatment episode record is submitted, all of these fields are part of that treatment episode record. One of those fields is injection drug user code. So if a provider treatment episode record is submitted, it must have an injection drug user code. And the other piece I wanted to talk about here was the vocabulary. Generally, fields that have a code at the end of it, in fact, not generally, fields that have a code at the end of it will have a related vocabulary set that they must be validated against. In the case of injection drug user code, it's one of the fields that uses a shared data set, the no, yes, refused. So if we go back to, I had it up. If we were to go back to the vocabulary list, there it is. If we went back to the vocabulary list and looked for refused, these would be the valid values. So you have 7400.0 is no, 7400.1 is yes, and 2100.6 is refused to answer. So anytime you have a field with a code, that's how you would check the vocabulary. You would go to the dataset code values document, and that's where you would find the valid values for that field. And the
Okay,
last,
James, I
yes.
know you want to wait till the end. Y'all are probably fixing to cut me off, but the fields like citizenship, the drug user field, the HIV field, for the users on the call, two or three are the fields that you didn't have in the CDR. They are required with TEDS reporting. I don't know, I can't answer the question why the CDR did not require those values, but I had a question about adding these codes that weren't in the CDR. Why are we having to add them now? And then for James, I guess there's a question, do they need to go back into active clients or previous clients and populate those values because they're now required?
That's a really good question. So just to make sure I understand the question you're asking, so in the case of, well, let me sort of give you an example, and I think I understand what you're asking. So we've gone live with the data warehouse. A provider has a client that started in a provider has a client that started in March, and that client is now being brought into the data warehouse because they're an active client. If they are an active client in the data warehouse, yes, you would need to collect that information. If they were a previous client that sort of had a treatment episode that started in January and ended in February, I believe the direction is that that's not being pulled over from the CDR into the data warehouse, so you would need to go back and add that. But if you have a client receiving services that is being tracked in the data warehouse, you would need to collect all of the required information about that client.
Okay, because they probably have thousands of clients that were admitted prior to 2020. I mean, their admissions could be all the way back to 2002.
Sure.
And they didn't capture that data at that time. So even sexual orientation, there's a handful, maybe 5 or 6 fields, but I've not known how to tell them where to get that data because they didn't capture it when the person was admitted.
Well, if it's an active client, that's still in treatment, I mean, presumably they could ask. I mean, if it's a client from 2002 and they had a treatment episode that started and ended in 2002, then that treatment episode is not coming over into the and that client would not be coming over into the data warehouse unless that client was actively in treatment.
Okay, assume they're still active.
Assume they're still active.
Yeah.
Then my understanding is that the provider would need to ask the client. Shelby, is that your understanding as well?
Yes.
Okay. And I've seen a couple of questions come in on the chat. If they have a social, then it would be yes for citizenship. I believe citizenship wasn't yes or no. I believe it was actually sort of the country of which they're a citizen. There we go, citizenship. Yeah, British, Canada, Cuba, etc. So yeah, so if they had a social, it would likely be United States of America. But obviously, the citizenship would need to line up with whatever the values are there. Sexual orientation is voluntary. I believe that's in the client data set.
It is optional. I just looked it up.
Okay, thanks, Shelby.
Mm-hmm.
Okay, so you had one provider say there's 16,000 records to update.
So
do we need to make a decision at a state level to populate something in these fields? If we say no, it's not really accurate data if they are, like HIV.
Yeah.
So I'm kind of walking a fine line here. So I know they want to be accurate, but they don't have it documented.
Yeah.
They would have to go back to the client. The client is not on premise. I mean, I don't know what advice to give them for these fields.
I have some. So the month of August, you will be submitting your July data. You only have to submit for clients who received services in July, which is probably not going to be all 16,000 clients, I'm guessing. And so you update that information as you see the clients. and as they receive services would be my recommendation. So the clients you see in July that are getting services in July, you ask those questions and you complete the record. Then the clients that you see in August, if they don't have the information, it's updated when they receive services in August. Does that make sense?
So
It
do we
does,
need,
but it's not a simple task.
Yeah.
do we need to create a new form to gather this information? Because usually it would be like on the intake or something in the very beginning. So now we're going to have to go to our different medical records companies or whatever and get another form created to get this information for all of the clients that have been here for years.
Shelby, is there any way in the data warehouse to do this going forward with admissions or services and not make it required for historical data? I know there's a cost involved. I'm just asking if it's possible.
My notes are going crazy. I'm going to put it in the chat. So.
Would that not necessarily just be, if you've got somebody that you haven't seen in some time, when they come back in for services, I think the front desk, when they schedule them, has to get updates on them. So it may just be a procedural issue to where, you know, that's the front desk knows that, you know, these people are going to have to go back in and fill in the intake pieces that are missing that are currently required. Just a thought.
Well, and I think we put together a new face sheet. It hasn't been presented yet since we aren't live with WITS, that includes enough information for an intake. CG or Kim, is that correct? That we could supply them with an updated face sheet that has the data that they need to capture?
Kim says sure. And just in case any people haven't been watching the chat, Shelby said we can check on that on the fields that check on the viability of what it would take to not require it for historical data. The list of what is required would be from the submission from the submission form for client, the client data set. And if you were just to look through the required fields for the client data set, that's where you could get that list.
Your EHR shouldn't have to change with an additional face sheet. I'm trying to eliminate you guys having to print a face sheet if you have it in your EHR. I'm assuming that's what that means. With updated face sheet means the EHRs will have to change forms again. Okay. So I've talked to certification. Sandra is over that area now, and also Dawn, who is the director of certification. And she has received this updated face sheet, but I have talked to them about eliminating a paper face sheet and then coming in and viewing your EHR to make sure that you have the data that's needed. So hopefully that will help with not having to print one. But I also know internally our state programs like to keep a face sheet in a person's chart in the event they don't have access to their EHR. And I'm not sure if you guys do that also. But the face sheet that we created was to try to help gather the information needed for an entry into WITS. And that we have not published it yet. It's not on our website or anything. So and certification doesn't have it.
Okay. So that's a lot of discussion on that. It sounds like we have some open items we need to follow up on. But for now, I believe the position is that that unless there is a change, the providers would need to provide the required data for any active clients when they receive services. So if you have 16,000 clients that are active, but only 1,200 receive services in for the month, then the 1,200 that received the services, if they didn't have that data recorded, which if they were in the CDR and those fields didn't exist, they wouldn't, you would need to get that information. I like the recommendation of just sort of as they came in, you know, saying, hey, we have to update your file. We need to track this new information. So the other thing I had, unless there's further discussion on this, but if we don't get it, we can't submit that client for the month, correct? Yes, so if a required field is missing from a client record and you try to submit the XML without that field, you'll get an error when you try to submit that file.
But one thing different, I do want to, I guess, reiterate with everyone is that the client records that are good will be processed. There's not a 5% error rate that stops the submission from an agency. So it would only stop, and James, correct me if I'm wrong, I think it only stops that client record that has the error.
Correct.
And it will take all of the good records.
Correct, yes. And the other thing is, if you don't have to just sort of pick out that one client record. You can create an XML that has the fixes in it. But if you send the whole file in again, it'll just treat all other data in the file as an update. So obviously, if you send a file and have some problems and go back and fix them and send it again, that's fine. If you send a file of all your updates for the month and send some more updates and then go back and send the fixed ones, then and the fixed file was the original file, then you could overwrite something, if that makes sense. That was a lot to go through, but did it make sense?
That was, I think you need to slow that down just a bit.
Okay, sorry.
So if you have client records in error.
So let's say, you know what, let's do it this way. I'll do a little notepad example. You have file 1. We'll say, and we'll say, and I'm just doing this just to sort of create an additional data point. So then we have, if we then say, oh, client D was, there was an error because we were missing some data, and then we do, now we have the data.
In your first example, the first 3 clients had errors, but the 4th client didn't. So the first 3 clients would go into the data warehouse.
The first 3 clients did not have errors, and the last one did have an error.
Okay.
So the first 3 clients went into the data warehouse, and the client D did not go into the data warehouse because there was an error because we were missing data.
Okay, so did they only submit client D after it's fixed?
That's what I'm getting to. There are two ways we could do this, and I wanted to sort of show the repercussions of each. So in method one, so what I'm showing you is the output from the data warehouse. And well, actually, the output from the data warehouse would be more like this, because the data warehouse will just say you had three clients created successfully, and here's the error message for client D, but we're not going to do that. So we're saying client A has a good record and is in the data warehouse, B has a good record in the data warehouse, and C has a good record, is in the data warehouse. D wasn't created because we missed some data. Now we have file 2, and we've gone back and we've added the data for client D, and we have and everything's great. That would work. We could also do, and this would work equally well, just this. And that was my point, was either of those would work, and that would be fine. The only time I would advise against sending everything in your update would be is if you did something like this. I'm going to start again. I'm going to start with here, down again. So this is file 1, this is send everything, and we have so that makes sense so far? I hope. Okay, maybe people are on mute. Okay, so another the only time we could have a problem with option 1 is if a provider sent file 1, got some errors, then sent file 2 and said client A is now married. And they get another error for client D because they still haven't fixed it. And then someone finally gets around to fixing file 1. They say, oh, there were errors on it. And they fix file 1. Oh, and they go back and resend it with client D fixed. And this would be a problem. What I'm going to do here, see if this works. Try that again. So bring it over here. Here we go. So, and I just did this to mark it up. So we have, so this actually we can ignore, just ignore the stuff at the top. Now, what I wanted to show you is file 1, client A goes in, client B goes in, client C goes in, client D is not created because there was an error. File 2, we're sending all of the data again, and client A is now married, was single, is now married. And client B, there are no updates, but we'll just send the data anyway, and C goes in, and client D doesn't get created again because they still have an error. And if someone goes back and resends file 1 with a fix, the problem comes because this will overwrite this because they're using an old file and we've updated client A since file 1 was first sent. So that is that's the only problem you could have, is if you had multiple people working with the files and someone updated an old file and resent information about a client that was no longer accurate. But I don't think that should happen. As long as you're just doing it, back to my first example, where you have file 1 and you got an error, and you have file 2 and you send that with the fix, then you should be fine. Does that make sense? If it doesn't make sense, I can sort of break this out into a longer email and try to explain it in more detail.
James, I think you've lost a lot of people.
Okay.
So
I'll
I think
break this out into
we
more-
need to come up with a way that we do it to correct the errors. If it's
Yep.
just only submit error records, then that's what we need to tell them, and we need to ask the vendors if that's possible, because they're going to need to go back and fix their EHR to extract the data. And I'm not sure that extract will only pull error records. So
I guess
we'll
that
just
was,
have to work through that with the vendors.
Let me lay this out in an email where, rather than trying to do it on the fly. I think you're right. I think I did lose some people on the fly. So let me take this one offline, and we'll work on it. And
Okay, but the overall message is that the good records will come through.
Yes.
Currently, James, we have if they get a 5% error rate when they try to upload to our current data warehouse, it doesn't take the records. They have to fix them.
Yeah, I got that from your previous comment. And yeah, no, if you have one good record and 100 bad records, the one good record will go in.
oh, I just feel like in the very beginning, if we're missing these fields, we have to create a way to get these fields, get them into our medical records, get the staff to get the information from the clients that we don't have. So, I mean, I understand that the only ones that are going to go through are the ones that are correct and the other ones are going to fail. But the amount of ones that are going to fail in the first month that we won't get credit for or won't be able to report on, it's like it's going to be a larger number. And I mean, it will shrink over time, but we have to find a way to collect this on a permanent basis. And then we have to find a way to get the information in to fix it. Because most of the stuff we would get on an intake or something like that, I believe. So I think that's where the problem lies, like the amount of people that we will have to fix in the beginning to make this work. It's not the submitting 100 versus 1,000. It's just, it's May and we have June and July to get this. Does that make sense what I'm saying?
It does. It does.
So, I mean, that was just where I was looking at it. It's just the number of people that were going to get kicked back in the beginning.
Okay, and then Roger, I saw your question. The good records will include the data they're to capture as they come into the clinic will be out. If the record has all the required information, it will not be thrown out.
And the other side to that is the data warehouse versus the 837. The 837 is what will be billing, not the data warehouse. So if we can start looking at the 837 for those grant funded that will affect your billing, those would be where I would start. I would also look at the one that has 16,000 active clients and make sure they're all still active. If you hadn't seen them in so many days or so many months or so many years, do you discharge? I mean, administrative discharge. I mean, this is a data cleanup effort because we don't want the new data warehouse to be like the CDR is today.
Hey Denise, this is Mike again. As far as like the submissions where we've got historical data that's got to be fixed, how will that affect if that, basically we go ahead and submit the data, and let's just say we submit 100 records, for example. If we've got 50 of those that are current, active, up to date, and they apply, and the other 50 are historical that we've got to go fix and clean up. Now, that's just an example number. If we potentially could have thousands that we have to address, it takes some time to get cleaned up. How does that affect billing on those services for those clients during that month? Say, if we get those fixed the following month, does it apply? Is that become a problem? What is the answer on that?
The edits that you're hearing now for the data warehouse are not the edits for the 837. So we're not creating client records from an 837 as they come in as full with all the data as we are with the edits into the data warehouse. I'm not sure if that makes sense. Shelby, maybe you can help me there, because the 837 billing, I know the data warehouse is very important to get our data to the feds correctly. But for these providers, that 837 billing and fees for service is very critical. And my understanding was these edits are not in the 837 for the billing portion. She may have to put it in the chat.
Yeah.
I don't, what edits? I'm sorry, I didn't.
The fields that were missing from, or the fields that are on the data warehouse that were not in the CDR. The question, are those in the 837? Because the concern is about getting, about billing for clients that may not have those fields populated.
Got it. Those fields shouldn't be in the 837.
They're not, but I just wanted you, if you will, try to confirm that and kind of send that out to the group, because I know that's as we move toward fees for service, I know that's a very, touchy is probably not the right word, but we're trying to make the best with what we have. And I know that 837 is very concerning right now, the billing and the fees for service. And I know the data warehouse has a lot more required fields than what the 837 does for clients.
Yeah, I'll confirm that. I was also going to send out an updated companion guide for the 837 because we removed an error message about delimiters. So you should get an updated version today anyways. And you'll be able to see what's required to submit that 837. And then Roger, your most recent question. So sexual orientation is an optional field, and then the GAF known code, you'll just answer no to. So those shouldn't be issues for capturing accurate data, but there are, Denise talked about some other fields that are required by TEDS but weren't required in the CDR. So there are some. So if you don't have those will not be reported to the feds until you collect that information. So it has to be collected at some point. And even, I mean, if you submitted a file to TEDS without that information, you would get an error anyways, wouldn't you?
You would. I've been having to fix those when I do the upload to TEDS. And I end up putting unknown because I don't know.
Okay. So those fields affect reporting to the feds for sure, but for grants and your billing, they shouldn't, is what it sounds like.
So does that affect reporting in grants?
So yeah, so it definitely affects reporting. Grants, I don't think so, is what it's like. They can still get paid by submitting the 837s while they're still collecting this information, is what it sounds like you just said, Denise.
And as for reporting, reporting out of the data warehouse, obviously the data that's reportable out of the data warehouse is what's been put into the data warehouse. So it would affect the reporting from the data warehouse.
Don't the clients go into WITS from the data warehouse?
No, they go into the data warehouse from your EHR. The data warehouse doesn't send anything back to WITS.
And Shelby, I think that was, it's probably a common question from the providers, because I think they thought when they submitted to the data warehouse, it would populate that data into WITS, and it doesn't.
It does not.
We are coming up to the end of the hour, but one more thing I did want to just give everyone a heads up on is that there were some additional referral sources being added, and those will be available in an updated data codes document that will be on the website soon. And I think this has been, oh, you're welcome. I think this has been a really productive discussion. I think we have some information we need to go back and research. Were there any other questions before we wrap this up? I am not seeing any. Shelby, do you have anything else?
I do not. I hope you all have a great rest of your week, and we will talk to you again on June 10th.
Thanks, everyone.
Thanks.